Your ultrasound says fatty liver, but here's the real question. Is it just fat, or has your liver already started developing scar tissue? Fatty liver can be silent for years. Normal liver enzymes do not always mean your liver is safe. Ultrasound can tell you if there's a fat in the liver, but fibroscan can help estimate whether your that fat is turning into liver stiffness or fibrosis. If you have obesity, diabetes, prediabetes, high triglyceride, or elevated ALT, this simple video is going to help you understand the meaning of fibrosis and the usefulness of fibroscan. Hello everybody, I'm Dr. PK. I'm board certified internist, and this video is for educational purpose only. So today we are talking about a very important test called fibroscan. Many people are told after an ultrasound, you got fatty liver, okay? But most of the patients are left confused. Is it mild? Is it dangerous? Can it become cirrhosis? Do I need a liver specialist? Here's the key point. Ultrasound can tell us there's fat in the liver, but fibroscan can help us understand whether the liver is becoming stiff, which may suggest fibrosis or scarring. And in fatty liver disease, scarring is what we worry about the most. So fatty liver is now one of the most common liver problems in the world. It's strongly linked with obesity, type 2 diabetes, prediabetes, high triglyceride, low HDL cholesterol, high blood pressure, insulin resistance, sugary drinks, and processed carbohydrates. The newer medical term for fatty liver related to metabolism is called MASLD, which stands for metabolic dysfunction associated steatotic liver disease. Earlier, people used to call it NAFLD or non-alcoholic fatty liver disease. But whether you call it a fatty liver, NAFLD, MASLD, the real question is, has the liver developed fibrosis? Because fibrosis means scar tissue, and advanced fibrosis can progress towards cirrhosis, liver failure, and liver cancer risk. So what is fibroscan? Fibroscan is a quick non-invasive test. It does not require surgery, does not require needle, doesn't require anesthesia. It's usually done in an office or imaging center. The technician places a probe on the right side of the abdomen near the liver, and the machine sends a painless vibration wave through the liver and measures how fast that wave is traveling. And a stiff liver allows the wave to travel differently than the soft liver. And this is how fibroscan estimates liver fibrosis. Think of it like checking whether your liver is still soft and flexible or becoming stiff from scar tissue. So there are two main numbers. Number one is liver stiffness, and this is reported as a kilopascals, kPa. Higher liver stiffness can suggest more fibrosis. In simple terms, lower stiffness usually means lower risk of significant scarring. Moderate stiffness means possible fibrosis. High stiffness may suggest advanced fibrosis or cirrhosis risk. But remember, fibroscan is not interpreted alone. It must be combined with blood test, platelet count, liver enzyme, metabolic history, alcohol history, sometimes other imaging. Second score we get is called CAP. CAP stands for Controlled Attenuation Parameter, CAP. This estimates the amount of fat in the liver. Controlled Attenuation Parameter. So fibroscan can help estimate both how fatty the liver is, how stiff the liver is. But from a long-term standpoint, liver stiffness is usually the more important number because it points towards fibrosis risk, cirrhosis, and liver cancer. So the question is, should we have fibroscan or ultrasound? Let's make this simple. An ultrasound can often detect fat in the liver, but ultrasound does not reliably tell us how much scarring is present. Fibroscan goes one step further. It helps estimate whether liver has become stiff. So here's a peripheral practical difference. Ultrasound answers, is there fat in the liver? Fibroscan answers, is there possible liver stiffness or fibrosis? That is why the patient with a fatty liver on ultrasound may still need additional risk stratification, and they need most likely fibroscan. Who should fibroscan, when should fibroscan be done? Who qualifies for it? So it should be considered in patients who have a fatty liver plus other risk factor, obesity, higher BMI, type 2 diabetes, pre-diabetes, high triglyceride, low HDL. So all these metabolic risk, people with insulin resistance, elevated ALT, AST, high blood pressure, metabolic syndrome, enlarged liver imaging, family history of liver disease, and concern for advanced liver disease. So current liver guidelines support a stepwise approach. First, use simple blood-based scores like FIB4, and then use FibroScan or another non-invasive test if patient is clearly low risk. AASLD guidelines recommend secondary assessment as vibration controlled elastography, commonly known as FibroScan, when FIB4 score is elevated or indeterminate. So what is FIB4? FIB4, before ordering FibroScan, many doctors calculate something called FIB4. FIB4 is a simple score based on age, AST, ALT, and platelet count. It helps estimate the risk of liver fibrosis. Now, a common approach is FIB4 is less than 1.3, lower risk. FIB4 is 1.3 or higher, consider FibroScan. If FIB4 is greater than 2.67, higher risk, consider hepatology referral. For the patients older than age 65, cutoff may be adjusted upward because age can falsely raise the score. Your liver blood test is not just about ALT and AST. Platelet count and age reveal hidden fibrosis risk. Who should not ignore fatty liver? You should not ignore fatty liver if you have belly, obesity, sugary drink intake, diabetes or pre-diabetes, high triglyceride, low HDL, high fasting insulin or insulin resistance, elevated ALT, sleep apnea, PCOS, family history of cirrhosis, heavy alcohol use. And here's the very important point. Normal liver enzymes do not always root out advanced fatty liver disease. Okay, that is why risk-based evaluation is important. What FibroScan cannot do, it cannot always confirm whether a person has active inflammation. It may also be less accurate in certain situations, severe obesity, recent meal before test, acute liver inflammation, liver congestion from heart failure, bile duct obstruction, poor technical quality. What happens after FibroScan? After FibroScan, your doctor may place you on into low risk group, intermediate risk group, and high risk group, and depending on those, you may need a referral to see a liver specialist. Can fatty liver improve? Yes, fatty liver can improve, especially in early stages. And the most powerful treatment is not magic detox, metabolic correction, weight loss, removing soda, sugary drink, reducing refined carb, increasing protein and fiber, regular walking, better sleep, control of diabetes, triglyceride, and blood pressure, and no alcohol. Okay? So fatty liver is not just liver problem, it's a metabolic problem which is showing up in the liver. So it's the bottom line. If your ultrasound shows fatty liver, do not panic. Talk to your doctor. Go over all these numbers I'm talking about and take care of health. I'm Dr. PK. Follow me for more simple, practical medical education. Thank you for watching.